Dr. Richard Downs with Sleep Balance Academy, and I have on the line today Katrina, and she's going to talk to us about a software called Bodysite, and it's used extensively by physicians, dentists, and chiropractors to help patients with compliance at home. And we just want her to go through and explain a little bit. Then at the end, when she gets done with her overview of the product, I'm going to explain to you why I think it's a valuable adjunct to your practice. And then Katrina will answer questions. So welcome. Thank you very much, Katrina.
Of course. Thank you for having me.
So would you like to share the screen?
Yep.
Okay, thank you.
All right, so we'll go ahead and dive into it. So Bodysite is both a web platform and as well as a mobile application. And the core value proposition of the Bodysite solution is really giving any healthcare provider a way to streamline patient education and lifestyle guidance, as well as remotely monitor patients between visits. So rather than giving patients verbal instructions or a simple PDF handout with instructions, you can actually streamline the care and the guidance that you're providing patients between office visits. So what we're looking at right now is what a potential private labeled web platform could look like. And then, like I mentioned, you and your patients would also get access to the Bodysite digital health app, which is available for both iOS and Android devices. To begin, we're going to go to plans. So inside of Bodysite, there are already over 80 care plans available to you as our client to use with your patients. We have weight management programs, we have diet programs, we have general health and wellness programs, exercise, mindfulness, among others. All of these programs are turnkey, ready-to-use programs. That being said, they are fully customizable. You can also use the system to build your own programs, which I'll talk about in just a minute here. But we're going to go ahead and just preview this health and well-being plan. It's one of our newer programs, so I'll showcase it for the purposes of this walkthrough. This particular program, like you see here, is 60 days. And basically, right now we're looking at day one. So if you were to put a patient on this program beginning on day one, they will receive all of the guidance automatically to their email inbox and then in the app and the web platform each day. And really the intention of these programs, like I mentioned earlier, is to streamline the patient education, guidance, and care that you're providing patients. So you'll see here in this section, we have tasks outlined for them to establish their why, drink water, watch a video, and move their body. This is a customizable list of tasks. So if there are things that you want your patients doing each day, you could take one of our programs and add to that task list. You can also build your own plan from scratch. So if you wanted to create your own custom program with your own unique tasks in it, you're able to do that. The benefit of the tasks is that each day the patient is going to be able to see exactly what they're supposed to be doing that day. And their check boxes, so the patient is able to check off that they've done that specific thing. And then when you go into their record, you're able to see their compliance with those tasks, which I'll show you in just a minute here. As I mentioned, you can use our content management system to build your own program completely from scratch. So if you have your own program outside of our 80+ care plans, it's very easy to build your own programs. And we also offer trainings to help you with content creation inside of your account. So once you have a patient enrolled into the system, there's a number of different ways for them to engage. So first and foremost is their task compliance. So I mentioned most of our plans have tasks on them. It's a customizable list of tasks, and you can also, create your own tasks. Each day, you're going to be able to go into the patient record under the progress section and actually see exactly what they're checking off or not, as well as the week-over-week overview. So really the benefit of the tasks is that you're able to see their compliance with whatever your set instructions are. Patients are also able to use Bodysite to track foods, which includes calories, body metrics, and activities. So as they track any of this data, you have the benefit of seeing that all in real time. So for food tracking, if you're putting them on a weight loss program, it might be important to monitor what foods they're eating or how many calories they're eating. For body metrics and activities, they are able to track everything that they're doing in real time. So for example, with weight, if you have them tracking their weight each day or each week, that will be graphed in real time and then also shown as a data table. You can also use the activity tracker to track certain things that a patient is doing. By default, they're able to track exercises, steps, sleep, and glasses of water, but you can add custom activities to this as well. So if there's certain things that you want them doing, like a certain number of times a week or a day, you could add custom activities in the settings of your account, and then your patients will be able to track how often or how much they're doing that specific thing. So if you want them, let's say, doing a mindfulness exercise 15 minutes a week or a day, they're able to track that. And then again, you can remotely monitor their compliance with that. Bodysite is integrated with a handful of connected health devices. So we're integrated with Apple Health, Apple Watch, the Oura Ring, the Enotech scale, the iGlucose glucometer, InBody, and the Withings blood pressure cuff. So if your patients have any of those devices, as well as Fitbit, I don't think I mentioned that. So if they have any of those devices, they can actually sync their account to Bodysite, and then that data would come through automatically in real time. Beyond all of the tracking, there are a number of other tools available to you. So first, the patients have a journal where they can journal about their progress or how their day's going. If they mark their entry as shared, you will be able to see it here inside of their journal. So you might use this if you're wanting them to keep some type of journal about sleep habits or anything like that. There's also a document box inside of Bodysite for easy document sharing. So if there's any PDF document that you need to share with a patient for any reason, you can use the document box to share it in a HIPAA compliant way. And patients are also able to share documents with you. Photos is a place for patients to share photos with you. So if there's anything you're asking them to share a photo with you about, it could be daily, weekly, monthly, before and after photos. They're able to share it right inside of the app as well as the web platform. Encounters and notes is a place for you and your team to make notes about any interaction or encounter that you have with a patient. And these are completely private to you and your team. So the patient is not able to see these. A couple other final features. Number one, we have integrations with FullScript as well as Rupa Health Labs. So if you're using either of those systems, you can actually sync your account and use them right inside of Bodysite rather than having to navigate out to FullScript or out to Rupa Health. We also have HIPAA compliant messaging. So using this system, this is a great way to communicate with your patients and touch base with them, or a way for patients to ask you questions in a way that's HIPAA compliant and where you don't need to give out your personal cell phone or open up another outlet of email communication. It's all HIPAA compliant and secure right inside of the platform. If for any reason messaging is something you're not interested in, the answer is yes, you can turn off messaging for the account. And then last but not least, we have our telemedicine solution, which we call our virtual clinic. The virtual clinic is a great way to meet with patients virtually. So this is included with your account at no additional cost. You can have one-on-one visits. It's very similar to what you experience on Zoom, where you can turn on your camera, talk to your patients. There is a scheduler built into the virtual clinic, and also gives you the ability to have group visits of up to 50 patients at a time. So if you wanted to do some type of monthly session or a visit with multiple patients at the same time for some reason, you can use the virtual clinic to do that. So that's kind of the bird's eye overview of the entire platform, top to bottom. Any questions, or is there anything that you want me to go into more detail about for you?
So thank you, Katrina. That was really interesting. Tell me about, you said you can share photos. Can you share screenshots of your phone with this software?
Yep, screenshots are just photos. So yeah, you would be able
Yeah.
to share those.
And I noticed in here that you do have some integration with different devices, and you're planning to add more devices in the future?
We're always growing our integrations list. Our development calendar is pretty much always booked out 6 months out. So there's none coming anytime soon. But we always add integrations as they come to what we call critical mass, where lots of people are requesting it.
Great. So I saw a little part in there where you said you could monitor patients' sleep. What does that look like?
So for sleep, that's just for them tracking the hours of sleep, not stages of sleep or cycles or anything like that.
Very good.
It's just one of the options under activity where they can track their hours of sleep. And if they have a Fitbit or an Oura Ring, that data will come through automatically from there. If there's anything else you want them to report about their sleep beyond that, more anecdotally or written, I would use the journal for that.
Yes, that's really good. So dentists are quite good at having patients come back every 6 months for preventive care. Could this software be used to enhance their ability to bring patients back to the practice?
Perhaps some of our clients do build programs, custom programs inside of their account to engage patients between their appointments. Or like, they might build a 6-month program to keep the practice top of mind. So that could be something that you can consider building into the platform, is a engagement program of some kind where content is dripped out to them, perhaps on a weekly or a monthly basis, not as often as daily, just to keep the patient engaged between appointments.
This is really good. And so I suspect then that you can do some procedures for patients that used to have to be done in the office, but now you can do it via this remote system and telemedicine visits, which frees up chair time and room time for patients that might need to be seen personally. Is that correct?
Yep, as long as it's not an appointment where you need to physically touch them for any reason or be present with them, you can use the virtual clinic for telemedicine visits, which is great. You can charge for that using your own system, or there is a built-in e-commerce platform if you're cash-based.
That's very interesting. So you can actually put in a billing platform inside here for certain things that you might want to bill the patient for.
As long as it's cash-based.
Okay. And when you say cash-based, what does that mean?
Our integration is with Stripe, so they would be using Stripe to process those payments.
Exactly. Thank you so much. I was wondering about the custom programs. How difficult is it for a person to put in their own set of instructions for a patient that would need to have something specific done for that practice?
I mean, the content management system is fairly easy to utilize, but obviously anything requires a little bit of a learning curve. We offer full training though, so if anyone needed assistance, they can always schedule a training to go over how to do that. But I would say it's fairly easy. If someone struggles with tech in any way, they might need a little bit more hand-holding, but overall it's a pretty easy to use system.
And I just got a couple more questions, and then I think that'll sum it up. So you do some sleep monitoring and also glucose monitoring, blood pressure monitoring. Do you do remote patient monitoring through this program that's a billable procedure to CMS?
So with this system, you can use it for remote patient monitoring because we're integrated with FDA approved devices that can be used for RPM. The actual billing to insurance for RPM would happen outside of our platform. We don't facilitate anything related to the actual billing to the insurance companies. But since we're integrated with RPM devices that are FDA approved, you can use the system for RPM.
So you could use the data that you're getting from this on the electronic medical record as a way of showing compliance with these remote patient monitoring systems. Is that correct?
Yep. And then with the way it works for RPM with the CPT codes, there's a certain amount of time that you have to monitor a patient each month.
Right.
And so there's a timer built into the platform, which you'll see under the time log, to keep track of that time. On the chance you're audited for any reason, you have a record of, the time that you're spending monitoring their data.
That's exactly what I wanted to see. Thank you so much, Katrina. This is
Yep.
fascinating. I can see it as a way to reactivate patients that haven't been in for a long time. I can see it as a way to help patients become healthier because they have a motivation. And also, patients want contact with their healthcare providers. And this is a way of allowing access to the healthcare providers that never existed before. I think it's wonderful. And I'm looking forward to making sure that my clients know more about this and what they can do with it. Thank you so much for that.
Yeah, you're very
Appreciate it so
welcome.
much.
My
So
pleasure.
let me just stop the screen share here, and then we will say our farewells, and I'll talk to people about you at the Portland meeting and at future meetings that we're going to go to. So thank you very much.
Yeah, my
Bodysite
pleasure.
sounds like a wonderful solution. Thank you very much.
My pleasure. Thanks for having me.